Okay, we'll try this.
Can you hear me okay?
Yeah, you'll just have to speak up a little bit.
Okay. Is this better?
I think that's okay now.
Okay. I'm just trying to introduce you to Community Center Canada, talk a little bit about our own evaluation strategy and how it overlaps with the guide, and just give the outline of the 4 steps and be so bold and specific next time, just to share some advice and experience we've had in research and evaluation and programs at CSTP. Next slide, please. For those of you who don't know what Community Food Centers Canada is, we're a nationwide organization that launched in July of 2012. The Community Food Center model was developed over 14 years at the Stock Community Food Center in the Davenport West neighborhood in Toronto. We see a Community Food Center as a space where community members can come together to share, cook, grow, and advocate for good food. And to use the language in the guide, all of our Community Food Centers have 3 core areas of community food access. One is access to good food through food banks or community meal programs or good food markets. Food skills programming around cooking, gardening, health, baby, perinatal programs, and after-school programs. And also education and engagement, where we aim to give individuals and communities a voice and agency on food, hunger, and poverty issues that matter to them. And through these programs like our community active training, our community advocacy offices, and our social justice clubs. Because this talk proves that food can be the beginning of an ongoing transformation in the health and quality of life in low-income communities. And because when Jamie Oliver did said, hey, there's a good talk and every time you listen. So Community Food Centers launched, and our goal is to have 16 partner community food centers across Canada by 2017. So keep an eye out on our website as these new agencies and partnerships develop, and we'll keep it coming on. Next slide, please. So what do I do as a research evaluation manager at Community Food Centers Canada? I spend a lot of time in the proving department. We're trying to prove across sites and demonstrate a collective impact that we're making, creating access to healthy food for low-income community members. We are increasing skills and knowledge and behavior change around healthy food, decreasing social isolation, and increasing connections to a variety of supports in the community. And we're increasing knowledge and action around poverty and food systems issues. Looking for effective actions on some of our specifications in Canada. We're also looking to provide new markets for local food producers as well. So we track this on a site-by-site basis, but some of our programs are tracked right across all of the centers to kind of report out on the collective outcomes or collective impact on our site. We do that through a customized web-based tracking program, and that helps us capture the numbers or the outputs, things like the kilograms of produce harvested in our community garden, number of unique participants in our site, and our volunteer hours. We also conduct an annual program survey across all programs across sites. We do the same for after-school programs, community action training, community advocates, and volunteers as well. We also spend a lot of time on the inquiry side, which is very important. We do things like evaluating our evaluation tool. We'll get back to that in a bit. Using our evaluation tools to be back into the program planning cycle, and using a developmental evaluation approach to inform our community food center partnerships as we progress over the next number of years. We have a unique challenge in centralized evaluation where we have a central component to this. We have multiple sites and one evaluation program manager to oversee all of them. So a lot of our time and a lot of the fun part is building the evaluation partner capacity across the organization at the community food center. That involves a lot of sharing ideas with our program coordinators and facilitators and our site managers, and helping them build their own program-specific evaluation tools that are customized, that are consistent across the program. So they'll look quite similar, but they never look exactly the same. Next slide, please. So we look at the 4 steps in the guide. The first one is when we're actually trying to achieve. I'll apologize for using the most overused criteria in the evaluation world, but there's a reason why we feel on it, because it's true. I'll come back to that in a minute. There's a lot of anxiety around evaluation and organizations, but to quote MacKay, I say just do it. So you don't have a baseline data, who cares? This is where the little R research becomes pretty much art rather than science. It becomes how you frame your question. You can ask things retrospectively, like if you've been in this program, have you noticed any changes in your physical health? You can be a little bit creative. It's not rocket science. I don't think anybody on the panel list that has a rocket science degree. Everybody can do it. It's just a matter of being able to ask questions and get the answers that you need. The guide covers the program one model, really well, and what gets left out a lot of times and gets touched on briefly is things like the theory of change and assumptions that are work around the logic model. I can't emphasize enough how important the theory of change is. You can't really make a logic model that says we're going to do this and this is going to happen without knowing why things happen or what you need to do, kind of the recipe of what's going to happen. And so when you're doing a program around food and physical fitness, and you really would like to see cholesterol level change in your participants or their blood pressure come down, you kind of need to know how long that realistically stays and what changes and what focus you have to have in your program and level of commitment for your participants to see that change. The same thing with running a cooking group. The contact time to actually see behavior change and confidence change around cooking skills different between adults and children. The research is out there. Somebody's probably done it somewhere, so you can just find out how that can inform your program planning. And if nobody's done it and it's really innovative, that lets you know that you just have to pay a little bit more time in capturing the process part, not just the outcome, so you can share your success with others so they can use it in the future. The stronger your theory of change is, the easier it's going to be to set a reasonable benchmark for your program and help you form the evaluation questions that will capture the change you're hoping to see in your program participants. We'll be sharing our theory of change on our slide knowledge page, so keep an eye out for that. Next slide, please. Meeting participation and asking evaluation questions. So we're here in step 2, but I say almost just step 4. So think about what your final report's going to be, what the structure is going to be, who's it for, and what you need to say. That'll really help you come up with a clear evaluation strategy. You want to ask just enough questions, not too many and not too often. You don't really want to see the person doing both evaluations in your staff or, more importantly, in your participants. So don't hesitate to bundle things up, like a telecom company. If you've got grad students that need the questions answered, or you might want something answered that you don't really need to know on the national level, but you're doing your annual program survey anyway, or you've got a consultant who's doing a social return on investment analysis for you, put all those questions in one contact survey or questionnaire or focus group and get them all answered at the same time instead of going back to things over and over again. You want to make the value of the evaluation clear to everybody. You make it, especially for kids, try to be able to template things, focus more on activity. And you don't want to really over-evaluate. You don't want people to be asked things all the time or feel like that's a bigger part of the program than the actual program itself. And as far as the value being really important, given that, it should never be an afterthought. If you're putting up a job description for a cooking class coordinator, they need to know from the outset that 10 to 20 to 30% of their time is going to be taken up by crafting evaluation. They need to build it into their curriculum of how they're going to deliver creative post studies and things like that. It's also really important for your program facilitators if you are delivering some types of evaluation to let participants know what it's for, that it's important for funding, that it's a way for their voice to get heard. We want to hear the good, bad, and the ugly, so that it helps people understand it and it gets more volunteers to participate. It also becomes really paramount funding. If you're funding a program or looking at the business plan for your organization, evaluation is really a big component on it. As far as I'm concerned, I'd rather donate to an organization that tells me exactly what they're doing and what the results they're getting, so they spend more money on their overhead, not an organization that's saying that 95% of their dollars go to programs, but they can't tell me really any of the costs that they're having. So don't be afraid to put it in there in your funding proposals in your business plan, because it really should be there. And helping others love the process as much as they love the results is really important. When I sit down with a lot of our program coordinators and I ask them what they like most, they love the results, what they wish that they did the work that helps you getting it. So you really have to find out what people like, and more of that. You have to find out what they hate and do less of that or make it better. You can't tell them that they don't have to do it. You just have to find a way that can get everybody on board. And a really important part of that is letting them see the value of it and getting other champions within the organization or other sites that you work with to explain how they use the results and the benefit for them. Don't be afraid to ask for help. We're not all experts in all areas of evaluation. You should probably know about things like developmental evaluation or social return on investment and keep on top of evolving methods and practices. But don't be afraid to hire consultants or get advice help from an advisory group should you need it. And also know when you need an external evaluation, when that's indicated, and be open for it. The last thing on this page is to make sure your evaluation strategy doesn't build in any bias, specifically around literacy, numeracy, and language. It would be way easier for us to do a written survey for our annual program survey, but at the stop, we would exclude about half of our community members if they expect them all to be able to write and understand the questions and comprehend things in English. So what we do is we try to do an interview format. Even with that, we have a significant portion of Spanish speakers in our community members at stop. So this year we translated the survey, we had Spanish speakers doing interviews, and then we transcribed the results back into English, and we budgeted for it. So that's another important thing, to make sure you budget for it. You can't really rely on full time to translate for them unless you understand the language that they're speaking. You won't know if people are influencing how the full answers or actually giving you the answers back in their own words. You can sit there and listen to a back and forth side conversation going for 5 minutes, and then your translator turns back and says no. Obviously, you get something. Next slide. I think as far as gathering evidence and outcomes, one of the most important questions we can ask in evaluation is the why not. If we're not asking it, we don't really get a lot of value about our programs and about our participants. So you need to have a strategy to follow up with dropouts in your program. And if you're asking a yes question, then you're expecting a yes answer that your program works. They say no. Make sure you ask why not. If the only way for us to find out if the problem is within your program or if it's outside of the program, that community food sentiment, if there's something going on in somebody's life outside of the program that has affected their ability to attend or come to the programming, we can refer them to our community advocates for help. Or sometimes we find out that you need to provide childcare gets people to come out or transit coaches for people to be able to benefit from your program. So that's the main room for unexpected outcomes. As we put results-based evaluation, we focus a lot on what we're expecting, and we don't make room for figuring out if we're actually making things that we didn't actually expect our program to make. This year on our annual program survey, we had really great questions that I really liked, and we got some amazing answers. One was, what is the most valuable thing about having a community food center? And the other was, what would your life look like without the community food center in it? Being a food center, social isolation. We heard about people being fired to go back to college, people who were coming to the program to improve their English language skills. We heard about people being kept from being homeless, so they didn't have to make that decision whether to have a roof over their head or help for their kids. And you actually realize that sometimes it saves people's lives in ways you didn't know they would. So without asking people questions that can capture an expected outcome, you're maybe missing opportunity to capture social change that you're contributing to you didn't even know it. Timing matters for everything in life, not just evaluation, but you want to make sure that if you're running a program that you're building up skills or knowledge that will need to apply before you actually know if it's helped them out. You can't really capture that right at the post-program survey. You need to follow up on some length of time outwards, whether it be 3 months, 6 months, or a year, to find out if the awareness and knowledge and confidence you need for your program is actually contributing to the behavior change, whether it's sustainable change, and to make sure that it is valuable to your participants. Time of year is really important. We try not to ask starting group questions in July and August, or what people are on holidays or people hot, maybe their seniors population. September is a better time because people are back in their routines and it works really great. You also want to start trending your results too to help determine when you can kind of back off. If you've got a really consistent, effective long-range program, you don't necessarily have to do your outcome evaluations all the time. You may want to track your numbers still, but if you're not seeing any significant change, maybe go from annual evaluation every 2 or 3 years. At the same time, it can help you know if you're ready to move up to the next evaluation. You really have just been focusing on process and outcomes at that point. Next slide, please. Step 4 is a really important step that, again, can't be overstated how important it is. I think everybody gets hung up on attribution or getting credit for things, especially funders. They want to know that you made a particular change. But I think people need to step back, take deep breaths, and let us go. There's so many confounders around food and determinants of health. I think we need ready to discuss that our program is helping, but in of itself, it's no cure or magic bullet for any of the social illnesses benefits. So don't try to overstate your claims as far as the change you're making. Be happy with reporting that your program or organization has contributed to positive change, and be proud of that, and don't try to sneak anymore. It's also important that we don't want to overthink in the areas that we want to look at policy. It can be a really good funding strategy to be able to report out on what your organization has been able to do so far because of lack of funding or input. And you can say things like, we've come this far, but with your help, we can do so much more. As far as using your program evaluations for proof for public policy, it doesn't let policymakers also look for their share of the solutions of some of our systemic problems or around health, increased poverty, and hunger, we're seeing a survey in other organizations. So let people know that you're helping with the problem, but you need other help as well, and to help focus our team-based approach across the board. Evaluating your evaluation is really important. Helps you know whether you're running a bad program or just that's the wrong question. For example, we asked you to ask the question of vehicles on our surveys about food and vegetable portions and the numbers of servings you would have today. We found a drop in this number on a couple of programs, and we thought, wow, we're really not doing a good job of explaining why people should be eating more fruit and vegetables. And then we looked at the question. People didn't know what a serving size was or what a portion size was until they learned it in the program, and so they overestimated or over-reported at the beginning. Sometimes when you have people that aren't really invested in your organization and there's no level of trust or buy-in on their work, they sometimes tell you what you think you want you to hear so that they don't get excluded from the program. So just remind people that, be honest with your answers. There's no right or wrong answer. Don't pick questions that are bad. So now we ask people about the amount of fruit and vegetables they eat on a daily basis, and has that changed since participating in the program? And of course, if it hasn't, we ask why not. I'd say one of the most important stakeholder groups that gets overlooked is hard to share information that is your stakeholders. So your participants are the number one person you should really think about how to share that the evaluation that they've participated in. Without their buy-in, they won't participate again, and they need to see the value in it too. So think about ways that you can share this back so that people recognize that the voice is heard, especially if they're asking things about suggestions in a survey program. It's going to give you a good way to show people that their voice is being heard, and if they do that, and they know their voice is being heard, they're going to raise it more often and they're going to raise it elsewhere. Next slide. I'm going to add a step 5 here, and this step 5 is sharing your successes and your learning moments. I never call them mistakes. Just like food, evaluation is better when it's shared. You don't have to be formal in your sharing. You don't have to be published research. Research is great. Get your findings out there so we can all learn from each other. We're all part of the food movement, and then we really should know what everybody else is doing out there and learn from them and learn with them. By knowing what works and what didn't work, we're not all of your reinventing wheels, fixing wheels all over the place, and getting stalled in our tech as well. We can keep innovating and changing, make sure we're all doing the best job we can. So use what others are going to strengthen or build your journey of change as well, and grow your own evaluation capacity and ability. Share it through webinars like this, conferences, knowledge exchanges. One of the things when we launched the CDPAC Center in Canada July 2012, we also launched the Pod Knowledge Exchange, which you can find linked to our website. Our focus is on building capacity as advisors in areas like fundraising and communications through the national office. But we also found out that we had some pretty good recipes with the good information that we needed to share with people. So this was a way for us to get that out there, but also build a platform where it's part for research and someone to share it with and share that for you. It helps us highlight great research that's going on in and around food and health equality issues. And it gives us a way that it's an exchange. It's not a one-way thing. So please share your information with us, and we'll try to get it out there to get that with many people involved. Right now, we've got 1,500 members and growing on our knowledge team, and it's free to sign up and get access to our evaluation resources. The link to the guide is on this website, and you'll get invited to webinars, opportunities to share research, and when we come across great resources, we'll share them as well. Last slide. So I just put it there. If there's any questions raised during the presentation that doesn't get answered today, please reach out. Meredith Davis is our regular research evaluation manager. She's currently off on MacKay. She'll be back in July, but until then, you can reach me at CDPAC Center in Canada. Always happy to help anybody out. I have a good pleasure of looking at surveys and survey questions, and I love looking at them and helping people make them better. And we can help point you towards excellent research and resources, and then would appreciate anything that you have to share with us that makes us better as